Okay, good morning, everybody, and welcome to the Hourglass webinar, which today is around domestic abuse and housing, looking at the perceptions and challenging the perceptions around older victims of abuse and support housing. Now, since 1971 and the launch of the first domestic abuse service, Refuge for Women and Children by Refuge, the number of refuges and housing support services in the UK has skyrocketed. However, whilst these support organisations are essential, many of them do not consider or cater for certain victims groups, especially older people, but not exclusively. Older victim survivors of abuse may not have any of the suitable refuge or housing support options in their area. And if there is one, they may not know about it, or they may be afraid to use it. Abuse among older people is still a highly hidden form of harm and abuse, and housing support needs for older victims of abuse are currently not sufficient. Now, we'll be discussing that today, and we have 5 people online today to talk about this particular issue. Now, if you are tuning in to take part in this webinar, ask questions, please try to use the Q&A box to ask your question, and we will absolutely try and get to it. Now, if it's taken a while for me to get to your question, please don't think I've ignored it. I'm just trying to find the right moment to squeeze it into the discussion. Now, if I could ask all of the delegates just to introduce themselves and perhaps give us one challenge which is facing their organisation at this moment in time. And if we could start with Rebecca, please.
Hello, good morning. Rebecca Zerk from the Dewis Choice Initiative, which is based at the Centre for Age, Gender and Social Justice at Aberystwyth University. Dewis Choice is fundamentally a research initiative, but it does have a co-produced service that we deliver in the Carmarthenshire area. We support older men, women and non-binary people over the age of 60, and we established back in 2015. A large part of what we do is to disseminate the research findings through toolkits and training, and we've currently trained just over 15,000 people across the UK. I think for us, one of the challenges that we're facing at the moment is trying to secure further funding for the initiative. At the moment, we're looking for that, and I think there's only short-term funding and small pots available, so we're looking for something that is a bit more substantial and to keep us afloat for further years.
Thanks, Rebecca, that's really useful. Monsura, could you introduce yourself, please?
Hi everyone, I'm Monsura and I work with Solace Women's Aid, the Silver Project. The project is a specialist service for women who are 55 plus. We're an independent organisation who work with women, girls and young people, and some of our services does include men. So fundamentally what we do is we provide an IDVA type service for service users, especially for women who are much older. We did offer face-to-face and now we hope to go back to doing face-to-face at some stage. And we also offer training and upskilling all the different services in and around London. We are a pan-London service. I think one of the challenges, I mean, Solace Women's Aid is quite a large service, and much like Rebecca, we're a charity-based organisation. So one of our biggest kind of challenges is securing funding for all our really very necessary services, like our therapeutic service, for example, and our other specialised services that we have.
Thanks, Monsura. Mark, please.
Hello, everybody. My name is Mark Brooks. I'm the Chair of the Trustees of the Mankind Initiative charity. We've been running for over 20 years now, offer a national helpline and some pattern changing survivor courses for male survivors. We also sit on a number of government panels, advise government on the implementation of the Domestic Abuse Act, and also provide training and service standards and support for councils, police, the health service and others with respect to male victims of domestic abuse. In terms of the challenge, alongside just making sure the voice of male victims are heard in the current narrative around domestic abuse, which is an ongoing challenge. We obviously waiting to hear whether there's going to be additional funding to allow us to continue with the pattern changing courses that I mentioned, and we were funded by 6 police and crime commissioners. So we're just waiting to hear whether the government are going to reopen that funding. But broadly, positive. So challenges, but always opportunities too.
Thanks, Mark. And last but by no means least, Isobel, if you could introduce yourself, please.
Hi, my name is Isobel. I work for the charity Hourglass. I've been working there for just over a year now. I work in the frontline services team, so delivering support, advice and signposting to victims of elder abuse and their family members. I'm also a trainee IDVA, so I take on casework supporting victims of domestic violence. And I would say one of the biggest challenges facing our service at the moment is raising awareness of what elder abuse actually looks like, and making statutory services aware of how that manifests and how they need to potentially adapt the way they're interacting with those clients to combat elder abuse.
Thanks, Isobel. Well, look, we will plough into our first question for the day, which is about how effective domestic abuse refuges are at supporting victims/survivors who do not fit within that perceived stereotype. Now, there may also be a bit of a discussion about whether there is such a thing as a perceived stereotype here, but how do we think, and starting with Rebecca, how do you think, how effective are refuges particularly at supporting people who don't fit what is perceived as that stereotype?
Yeah, I think that perception is something that we had a look at existing services across the UK that were targeted for victims of domestic abuse. And from our review, we did find that there were typically white, middle-class, heterosexual women with young families that were advertised across those services, which really does impact on older people seeing themselves as victim survivors. But also from practitioners actually recognising that older people could potentially be victim survivors. So I think there is definitely that stereotype. It is unusual for older victims to go into refuge because of the barriers they face, but this is far wider than refuge provision, and I think it extends to all domestic abuse services and resources. We know that they are designed based on younger women, white women, middle-aged. And in terms of service refuge provision, the barriers include, lack of recognition of older people as victims. So right at the very start, they're not really being identified as victim survivors. But there's also a lack of awareness around the levels of risk that they face. Again, those risk assessments are based on younger heterosexual women who typically are experiencing intimate partner violence. And we know that for older people aged 60 years and older, they are as likely to experience abuse from adult family members as they do intimate partners. Older people have really poor visibility in terms of high risk services, so they're unlikely to have refuge offered to them. Very low numbers of our Dewis Choice clients have actually gone into refuge. Although the refuge staff have been very responsive and sensitive to the needs of older people, even them have identified that it's probably best that not the best option for older victim survivors, and this is partly due to younger women and family occupying the same space, but also they might be the only older person there. And the reasons why older people may not be accessing them is because potentially they're not designed and suitable for them. So we've seen numerous examples of women fleeing where they've been unable to find accessible refuges. Most bedrooms are above the ground floor. They don't have lift access, and bathrooms are not always accessible. So a lot of our older clients wouldn't even pass the risk assessment for entry into refuge. We know that older victims have a higher likelihood of complex health needs and disability, and they also have a higher likelihood of reduced mobility. Yet the service, the refuge provision really is not suitable for this. And there's also limited availability of 1-bedroom accommodation in the areas. I think for us, the COVID pandemic really exposed how much of a problem this was for older people. We had older victim survivors sitting in police stations and police cars for hours. On one occasion, we had our service staff, the housing support officers and the IDVA team all on the phone trying to find emergency accommodation for an older woman that was experiencing abuse, and she still ended up on someone's sofa despite everybody's efforts. So, you know, there was lots of added complexities, I think, that the COVID pandemic has really, I suppose, exposed. We've got, sorry, I let someone else have a go.
No, not at all. Thank you. That's really, I think that the reason why I sort of brought that to a close is mainly because you've really highlighted a point there of that's a really urgent situation. There was an urgent call for assistance there. And just before we do move on, what do you think is missing from the jigsaw of support, from your experience, Rebecca, which would have helped that individual particularly? You know, what kind of change could be made to help an urgent situation like that?
Yeah, I think the response tends to not cater for people who've got complex care and support needs. You know, even refuge spaces, if an older person's having care and support from carers coming in or family members, that having refuge spaces isn't conducive to having people coming in, and actually it might not be welcome to have them in. I think there is a call to have more dispersed housing that is more adaptable and suitable to older people's needs. We've also seen, you know, examples in the court processes where judges have been really reluctant to ask a perpetrator to leave the home, especially if they've got care and support needs as well. And we've seen solicitors encouraging older victims to stay in the home with the perpetrator because they could potentially lose their assets, and encouraged to just operate in separate spaces of the house, which is just not suitable at all. And actually in cases where we have seen them trying to do that, the risk has really escalated for those older people.
That's really useful. Thanks, Rebecca. Mark, do your experiences mirror that?
Yes, they do, and yeah, they certainly do. I mean, one of the issues with regard to just male victims is the lack of opportunity and the lack of availability of refuges. And I think no, when we're talking about housing, we should broaden our thinking, not just with respect to refuges, but also safe houses with wraparound support or dispersed accommodation, which is with, again, sufficient domestic abuse support as part of that, which is part of the direction of the government. So I think it's important to take into account safe houses and dispersed accommodation as well as refuges as being an option. So for men, I mean, as well as obviously all the issues that Rebecca talked about, especially around access, it's just around the availability, because if you took a line from, if you know your geography, from the kind of Wash, which is between Norfolk and Lincolnshire, and then drew a line all the way down to the Isle of Wight to the kind of west, left of that line, there are refuge and safe house accommodation all around the country, in Wales, the southwest, Midlands and the north. But if you go to the east, there isn't any in East Anglia, London, in terms of proper safe accommodation, in terms of refuge and safe houses, or in the home counties. So one of the things that really needs to be dealt with is actually having those choices available for men, including obviously elderly men, so that so that choice is available to them. At the moment, that choice in that part of England isn't. In the rest of the UK, there is some, but then there needs to be more. The other point, of course, is around, often it will be best for the victim to be in their own home. But the key thing is about making sure that there's occupation orders and non-molestation orders in place so that they're in their own home, but their perpetrator isn't with them. And I think that that's another angle that really needs to be pushed more. And we feel that the police and others could do far more to make all victims safe in that in that way. It shouldn't be the responsibility of the person who's the victim of domestic abuse to actually be the one that leaves their property. That should be a fundamental.
Okay, that's really useful. Monsura, can you give us your experience in this area, please?
Yeah, so mine, I mean, very much echoes nearly everything that Rebecca said. Our experience is very much the same. I mean, I can only talk for my experience within the London provisions that we have. So yes, older women are largely at a disadvantage. There aren't any safe homes, and refugees, as much as we'd like to think that they're all adapted, very few refugees are adapted in the first place. And secondly, there's a long waiting lists for those that are adapted and have accessible rooms. So as you can imagine, if you have a bed space of 15 in one property, you'll only have out of that 15, one room that's accessible. So you can imagine how long that waiting list will be. So in my experience, older women have also, in terms of the focus groups that we've run, have said, well, we don't actually want to go into a refuge because firstly, you have to also look at their age in terms of suitability, and also them being around other families and children, where they might also kind of feel like, well, they've done their time in terms of raising children or having children and families around them. They're at a very different stage in their life as well. And there just really isn't enough housing provisions out there. In terms of local kind of housing stock, I mean, we find the issue is far wider than just refugees. There aren't many housing providers that provide suitable accommodation or have accessible properties. Local authorities have long waiting lists as well for adapted properties. So it is a big issue.
And Isobel, is this something that you deal with often, the challenge around safe spaces for older people?
It is and it isn't. And the reason for that is because refuge isn't really considered even to be an option by our clients. You suggest it and it's just a no-go, because they understand that it's not going to be a suitable space for them, echoing what everyone else has said. They've got, people might have accessibility requirements. They might just need some, a quiet, peaceful environment. I mean, I've never worked with a client who has gone into refuge in the year that I've been here. And I've seen more instances of respite care packages being given out instead of putting that client into refuge, which obviously has its own issues, because those packages, a lot of the time, they're only providing respite care for up to 6 weeks. So that client knows they're going to be there for 6 weeks, but then they have to wait for that funding package to be renewed at the end. A lot of the time that funding package isn't renewed, so they're back to the same point they were 6 weeks ago. And also building on what Mark said there in regards to, refuge provision kind of being spread out, social isolation is a massive risk factor that we see within elder abuse. And even if someone was to go into respite, or even in the case of them going into refuge, being moved away from those kind of support networks just increases that vulnerability, and it's going to make it even more difficult for that person to get back to where they were before the abuse started.
Interesting. Thanks, Isobel. Now, whilst we've been talking, we've had an interesting comment here, who is very much dealing with the issue themselves. So the comment is that if the older person remains in their homes, their abusers will always know where they live. I think this is the safest way of being abused and around in your own home. Maybe I haven't read that right. Okay. So effectively, the individual who's commented here says that they're in hiding themselves at the moment, and they made that decision themselves. They still own the home, and they've had to flee from
Well, from a male victim perspective, the provisions that should be made are exactly the same as those available for all victims of domestic abuse. I mean, often we hear in the domestic abuse sector about or some concerns from professionals in local authorities and others in the health service about, well, what do we need to do different for men? Well, broadly speaking, nothing. And I think it's really important to understand that the safe housing, safe accommodation needs, and obviously the wraparound support is broadly the same for men as it should be for women. They may have to take into account certain aspects, such as obviously some of the barriers, the shame, the stigma, the worry about not being believed, that male victims certainly have an issue with, and it is a real barrier, and also the lack of belief in some areas of professional and public services, certainly not in all. So I think broadly the same. The key thing as well, and going back to the stereotypes Rebecca spoke about right at the start, is having this 360-degree view, because you will have gay men in same-sex relationships, you will have men fleeing from, you have gay men fleeing forced marriages, men, which obviously will potentially be elder male victims as well, and also men with children, because the stereotype actually when it comes to a male victim is a guy who has money and means, and he's okay for him to leave and leave his children behind. That's the stereotype. It's exactly, the mirror image really of what Rebecca was talking about. And I think we need to move away from that stereotype, but also don't throw the baby out with the bathwater. It's broadly the same support for male victims as female victims rightly get. So, no point reinventing the wheel in that respect.
So, Monsura, from a Solace Women's Aid perspective, you deal with women over 55, but you also touch on some services for men as well. What's your take on this?
Yes, I mean, we have found that there's an increasing number of men who are now accessing some of our provisions that we have. I mean, unfortunately, we don't have many. So we don't have a huge amount of experience as perhaps Mark would. I would say it pretty much echoes the same. There is lack of provisions in every area. In terms of my own experience with working with older women survivors, where there has been an older male survivor, so for example, where the abuse has come from an adult child, for example, it will be inflicted on both parents. So there's a lack of any type of support, whether it's wraparound, whether it's refuge, any type of support out there for those men needing to access that type of support. And the same, and absolutely what Mark said in terms of breaking those kind of stereotypes. And yes, men, if they do want to access these services, they need to go quite far in terms of how they can access these services, because there aren't many in London to start with. And if they were to, for example, move out of London because there might be a refuge somewhere out of London for them, then there may not be provision for them to take their children with them. So it is a very difficult place. So, I mean, from our perspective, we see it as just to be treated fairly. Absolutely. Where there are genuine male victims out there, we need to have more provisions out there.
You gave a real life example there of where an older child was abusing both parents. Rebecca, maybe how would you deal with that real life example? What would be how do we cope with these lack of provisions in the current environment?
Yeah, we've seen the same as Monsura here in our project, and actually, when both maybe mum and dad are experiencing abuse from an adult child, maybe mum is recognised as the victim, but dad isn't. And it can be really complex. We've supported a family recently where it is the son who's abusive, and the mother is almost minimising his behaviour because she wants help and support for the perpetrator. But dad is actually being exposed to quite high levels of physical abuse and emotional abuse. So he's really torn because he wants help and to leave the son to leave the home, but he also wants to remain in a relationship with his wife, who is supportive of the son. So it is really complex there, and I know the support team have been working with the mother to really raise her awareness of the impact that this is having on the father, and to try and get her support with helping the perpetrator and having him removed out of the home. But I don't think there's a one size fits all here. We know that older men, we know that 1 in 6 men experience domestic abuse, but our research with older men show that the rates may be higher in later life. For us on Dewis Choice, 1/4 of our sample are men. Most of them are over the age of 75, and they do tend to have higher levels of care and support needs coming into the service than the women we're seeing. And I suppose it's really echoing what Mark and Monsura have said, that older men are likely to have and face the similar barriers to older women in terms of accessibility and appropriateness. And what we'd really advocate for is kind of dispersed, accessible accommodation with floating domestic abuse support in place, which could be purposed for either men or women. I know Mark mentioned about men leaving and then having to buy another home, but that can be quite challenging for men who are at retirement age now and living on a fixed income of a pension, where they may not be able to get increase their income to be able to get a mortgage. And for both men and women, I think there's a real lack of awareness of their rights and entitlements in accessing safe housing and benefits, or accessing information in general. A lot of it is placed online, and not everybody is digitally connected. Lots of bidding for houses now takes place online, and they don't always have resources to be able to do that. So there is some significant barriers there for older people accessing housing, but also making informed decisions about leaving because of the lack of awareness of rights and entitlements.
Thanks, Rebecca. Just before we move on to Isobel, we've had a few comments here. So we've had a service manager based in the northeast. That's Rachel Williamson. We have a number of refuges and properties, including bungalows, ground floor units suitable for all. All refuges are self-contained, so no need to mix with other families if the clients don't want to. We sound really lucky, as our local authority is really supportive, and we work with adult social care to raise awareness and encourage referrals. So that's one interesting point. There are 2 questions here. I don't know who wants to come back on these. First one being, are we making referrals to adult social care plus linking in with GP, acute safeguarding within health? Is that something you can answer, Isobel?
Yeah, I can jump in on that. I mean, that kind of links in with what I was going to say in response to the questions about what provisions we should make in domestic abuse housing support. I think recovery and reintegration are so important, looking at after the fact. So once that person is safe, how do we reintegrate them into the community? Because especially with older victims, domestic abuse often has quite serious health impacts. So we might see mobility difficulties, we might see mental capacity difficulties, we might see the emergence of mental health issues that weren't there before. And so, like the question states there, linking in with those victims' GPs, with healthcare teams, making sure that they've had a care needs assessment, that they've got the right care in place, just kind of providing that holistic support approach, and multi-agency working is going to be so important.
Thanks, Isobel. Now, there is a question here for Sarah Brown. I will come back to that, Sarah. But the third question here I was going to ask was around how best local authorities and domestic abuse housing support providers can ensure that awareness of domestic abuse affecting older victim survivors is reflected in service design. I don't know who feels best placed to answer that question. Mark?
Yeah, I can come in, Richard. I think this is the real advantage of, well, there's lots of real advantages of the Domestic Abuse Act, because it places this duty on local authorities. It's called a Part 4 duty on local authorities, Tier 1 authorities, which are basically the unitaries, metropolitan boroughs or the county councils, to provide safe accommodation with wraparound support for all victims of domestic abuse. And this is a legal statutory duty now. There's no wiggle room. There's no, we don't take people out of area, or we can't afford it. All of that type of stuff, which lots of local authorities, not all of them, and Rachel alluded to local authorities in her areas, and this is set down in law now, and there's statutory guidance on this. So these Tier 1 authorities have a legal duty to provide safe accommodation with wraparound support for elderly victims of domestic abuse, and all victims in all shapes and sizes. So I think that's a really, really important point. And I think it's up to agencies on this call to hold those local councils' feet to the fire to make sure that they are providing that safe accommodation. And, for local authority colleagues on the webinar, obviously it's important in the strategies that have been just published on safe accommodation to make sure that is being accommodated. So for once, all of us have got some real teeth now and some real accountability that we can put on that. I mean, just on the fact about the referrals as well, just if I may, I mean, the issue is about whether, well, one of the issues is around whether elderly victims realise they are victims of domestic abuse. And I think, because domestic abuse is quite a technical term, so it's whether they realise that the abusive behaviours equate to domestic abuse in the first place. And I think there's lots to do with comms, communication campaigns, and spelling out the abusive behaviours rather than just saying if you're an elderly victim of domestic abuse, because they may not equate that. And the same job needs to happen with GPs and the police and social services, the same type of education process, because it's all very well saying, oh, there's a referral pathway, but if the GP is not actually using that referral pathway or even recognising domestic abuse in elderly victims, and then people won't end up going down the pathway. So there's some challenges there, but there's an opportunity. Please use the law to hold local councils' feet to the fire.
Thanks, Mark. Monsura, is that something that chimes with your day-to-day experience around housing support service design?
Yes, I mean, the DV bill, I mean, the DV Act, that's is a really good act that's come into place. However, we found that there's a lot of loopholes and a lot of legal ways that housing could get around this. Within London, there's like a massive kind of need for extra housing. So therefore, so when you're applying to making a homeless application, there's lots of different ways for housing to kind of say, well, we don't have a duty to house, because either they would refer on to a DV service, and that's them providing the wraparound service. And then it kind of goes back and forth between the Independent Domestic Violence Service and housing providers. I mean, what we're trying to do is build good links within the housing and have some of our expert IDVAs placed within these housing departments. Trying to also, I think what would really help would be for it to be made mandatory that all housing providers and other local authority professionals have training around domestic abuse and, you know, all types of domestic abuse, including older people. The other types of provisions that that perhaps would also work is for them to maybe take up the DAHA accreditation. And by doing so, it means that they'll have an extensive knowledge and training around domestic abuse. And not just that, also means that they're then able to provide the support, able to embed that into their own policies. So I'm talking about in all different individual teams within the housing sector, because you may have, for example, every borough runs their homeless teams very differently. So some may go through their triage team, some it might go directly to homeless team, might go through to tenancy sustainment teams. There's a lot of complexity around when you're supporting somebody who's older, depending on their individual needs, what type of tenancy they have, whether they have a joint home. You know, there's lots of legalities around that. What I'm finding more is that I'm actually, the number of referrals that I make to solicitors for housing advice has increased, because we are having a bit of a battle kind of going back and forth because the thresholds become so high now. And absolutely, in terms of identifying domestic abuse, a lot of older people don't identify as what their situation is, one of domestic abuse. And it's often kind of seen as, unfortunately, as physical abuse. And this is another kind of grey kind of loophole within the housing sector, because if they're not trained correctly, that is exactly how they would see it too. And if they're not trained properly, they would also look at, you know, where's there needs to be a burden of proof on the victim, as opposed to housing providers finding that information out. If there hasn't been any reporting, if there's not been, you know, X amount of incidents, then how relevant is it? How urgent is it to place this person into housing? And then it will then also come back to the support that they're receiving from the organisation that they're linked in with.
Rebecca, there's a couple of interesting points there I think that you can answer around training as well. So the training and the accreditation elements, that's something that Dewis do, isn't it?
Yes, we do deliver training across the UK. And I definitely think that what Monsura is saying is correct, and what we're seeing within our own local authorities with housing is that if the older person's not identifying as domestic abuse and the person doing the housing assessment is not identifying it, they're not going to be prioritised for accommodation for this situation. But we do have a list of recommendations for local authorities to embed into their needs assessment. So really looking at kind of demographic mapping of local population by age, that demographic mapping of the local population combined with intersections of those age, gender, disability. They do collect this already, but it's using that data then to inform that needs assessment. Mapping existing generic and specialist service provision with user data and disaggregating that again by age. So looking really at who's using their services at the moment and who is missing. We also recommend that local authorities ensure that survivor engagement activities reflect their whole life course. So including older victim survivors, and not just stating that they want older people to participate, but really identifying and addressing some of those barriers to participation for older victims. We also know that there's huge gaps in data and knowledge. So looking really to identify and address some of those local gaps in data for older victims of domestic abuse and using current data sets that they can pull from. So this might be the regional data sets, the national research data sets, maybe some small scale studies that are done, adult safeguarding, health and social care data, and the domestic homicide reviews, and really pooling that together and and trying to get a profile of what's happening in the area and what needs to be done to address the needs of the older people there. You know, the Domestic Abuse Act does require local authorities to form partnership boards. And although they don't have a set criteria of who should sit on those boards, what it does recommend is that the membership should reflect the specific needs of the local area. So if there's an area with a high BAME population or population of military service personnel, then that membership should really include representation of relevant service welfare representatives. And what that really means is that it should always include older people's organisations such as kind of advocacy services. And then we'd also advise that the equality impact assessments are really carried out on any policy development in this area and any commissioning to processes to really ensure that older victims are not inadvertently excluded from those assessments.
Thanks. So that actually, that your last point there goes back to the question that we had from Sarah Brown, which I'm now struggling to find on the chat, of course. Okay, my technological failure here. Okay, where has that gone? Apologies. Here we go. So do the panelists feel that there is a better awareness and recognition of older victim survivors of domestic abuse from statutory agencies and their need for support? Now that's quite a general question from where we've been going, but this almost seems like almost an umbrella question about some of the other issues that we've covered. Isobel, what's your take on that?
Yeah, it's a difficult question to answer. It depends what you mean by better. I think that there is awareness of the issues, but that doesn't mean there's not a long way to go. And I think that's one of the big things with elder abuse is that coercive control is at play a lot of the time, and the signs of that are very subtle and difficult to spot, especially if you're not aware of them. And often, a lot of the time, older people's accessibility needs or maybe mental capacity challenges, they can be utilized by the perpetrator to minimize what's going on or deny the abuse. So just kind of echoing what everyone else has said there, that's why it's so important to come back for statutory agencies to come back to taking an active approach to seeking out further training, seeking out second opinions. We receive calls on the helpline from social workers who just want a little bit of extra advice. You know, have I missed anything? We're happy to take those calls. And I think the second thing that I'd add on to that is just making information accessible for older people. Like what Mark said earlier, the term domestic violence, term domestic abuse, that might not resonate with older people. And a lot of the time they might say that and it actually shocks them because they don't see themselves as a victim, because there are a lot of barriers to them maybe identifying with that term. So it's making information accessible and making older people aware that, you know, that they could be a victim of domestic abuse, and that could be done through the simplest thing, like a poster in the GP surgery where the victim isn't depicted as a middle-aged white woman with children, but an older person who's being abused by their family member. Something as simple as that, you know, will grab that person's attention and say, oh, well, maybe that could be me.
Mark, is there greater awareness and recognition of older victims, older male victims? You know, what's your take here?
Well, I would agree with what Isobel would say. I think the stereotype of middle-aged or early 30-something white woman with a couple of kids is the stereotype. And that, as I said, affects women in same-sex relationships and older women, as well as men in that situation as well. And I think that's why it's really important, you know, given this decade is really being marked by inclusivity and being more recognising diversity. I think the domestic abuse sector and the way it's thought about and portrayed and the victims and the survivors and the perpetrators, in fact, is at least a decade behind the rest of society in terms of its narrative. I mean, with domestic abuse, we have to take a 360-degree view of this. Everyone can be a victim, everyone can be a perpetrator in terms of their protected characteristics. And I think certainly when it comes to older victims, I think that they're probably in terms of that narrative, probably the least thought of group of them all. And I think that there needs to be more, and what I recommend to government, but also local authorities, when they're running communication campaigns, and also making sure things like their website and also information sent to related agencies like the health service and the police, that actually elder abuse and the fact that it happens to women and men who are older should be part of that. And it has to be spelled out, because if you just put victims of domestic abuse, the cognitive biases and the narratives just come front of mind, and everybody else who doesn't fit that neat stereotype are just relegated. Often not on purpose. I have to say, it's not on purpose, but it's just unconscious bias. So we need to move. The domestic abuse sector as a whole needs to move far more quickly on that, as well as the government and public bodies.
Okay, and what about Monsura? What about the standardised way of assessing risk? Is that failing older people in that respect? And does the stereotype come into play there as well?
Yes, so the risk assessments that we actually work with are kind of firstly aimed at younger women. It's very much actually perpetrator-led as opposed to, identifying victims. It doesn't cover, there are lots of questions that it doesn't cover older people and what their needs and what their experiences are. Now, I think Isobel also mentioned earlier that coercive control plays a large part in the type of abuse that they experience later in life, and we found that very much so. So there isn't really that many questions. I think there might be one question that kind of relates to stalking and harassment and so forth, but there really isn't. So what I'm finding is I'm actually having to refer into MARAC on professional judgment more so for older people than maybe their younger counterparts. And that also means that some of the MARAC that happens across London aren't always recording the ages either, in terms of what the age groups are coming through to the MARAC. So it's not always easy, and it's not easy to collect that data to find out, what are the exact numbers that are coming through. Also means that people are more or less reluctant to make referrals into the MARAC on professional judgment. So therefore, a lot of these women are kind of falling through the net here and not getting the support that they need.
Okay, before I go to Rebecca, just a quick comment here from Karen Evans. She says that she totally agrees with what's being said. Some of the issues, though, is the lack of housing stock, especially with increasing numbers of refugees coming into areas who also have priority housing needs. It's also very difficult for where domestic abuse victims are homeowners and are too frightened to return to their home, even if they are successful in securing an occupation order. Where people aren't eligible for legal aid, the cost of getting the home sold where the perpetrator doesn't want to do this can be really high. And she's heard of 30K plus. But moving back to the awareness, or that broader awareness, Rebecca, do you want to come in on that?
Yeah, I agree with what has been said, and in our pilot area, we work very closely with our statutory organisations, and we have been seeing that they've really started noticing more at an earlier stage that there's domestic abuse occurring within the relationships and signposting them on. But we did a study for the Older People's Commissioner back in 2015, looking at an all Wales perspective. And what we were really seeing there was that practitioners knew what domestic abuse was in terms of its definition, but the application of that and recognising older people was where it became problematic. So if the abuse was from an adult child or a grandchild, that wasn't always picked up as a domestic abuse. It was often saw as something, just as theft if it was financial abuse. And they were often seen as kind of single incidents, one-off things that had occurred rather than a pattern of behaviour. And it was often that only one form of abuse was recognised. Now we know that there is often, whenever there is one form of abuse, there's often a coexistence with other forms of abuse. So if there's financial, it's very likely that there's also emotional and psychological abuse there. So we're only really getting a kind of snapshot of the risk of the risk and what was happening in that situation. And what Monsura said about the DASH risk assessment, it has been designed for younger people, but it's also been designed for heterosexual intimate partner relationships, which is really problematic for people who identify as LGBTQ+, but also people who are experiencing abuse from adult family members. There is still the view that coercive controlling behaviour is guised under the kind of care element, that they're doing this because they care for someone. And to give you an example of that, we did have an older woman who was receiving care from her daughter-in-law, and she would watch her in the shower, which she found incredibly degrading. But the daughter said she did this because she was afraid she would slip in the shower. And that kind of behaviour was seen that she was doing this out of care, and the recognition of that being abusive was kind of dismissed. So there is, as the Older People's Commissioner calls it, this kind of rule of optimism where too much emphasis is placed on the care and support that family members may be able to provide, and seeing that as a positive. In relation to housing, where there hasn't been suitable housing, we have seen older women and men move in with their adult children to escape from the intimate partner abuse, and then they've then become victim to their adult children and experiencing abuse from them. We've also seen parents moving back home with their adult children and building big extensions with their money from the sale of the house, and then that experiencing abuse from that, and then really trying to leave that house is really problematic in terms of the law, and trying to get your money out of something that you've invested into building an extension on somebody else's house. So yeah, I think going back to what Monsura was saying around risk, we have developed additional considerations for the DASH risk assessment. So things that people can consider in addition to asking those questions and really using their professional judgment to refer into the MARAC processes, because we are seeing that older people are not really coming through the doors of those specialist domestic abuse services, particularly at a high level of risk.
Thanks, Rebecca. We've actually had another question here, which I'll be very interested to see who's got a reply to this. So if older people are unseen overall, how do you feel this further impacts intersectional groups, i.e. LGBTQ plus older people, BAME older people, etc.? I know there are very few refuges, for example, that accept transgender survivors. Therefore, a survivor who is an older transgender person would surely have double the barriers to secure things such as housing that will fully address their safety. Does anyone want to come in on that? Okay. Rebecca.
Yeah, I think the trans has been subject to public debate, and I'm very aware that some of the leading organisations have stated that they've supported trans people for many years now, but there is really a dearth of specialist services, which is really problematic for LGBTQ plus people. And this really highlights the need for kind of support for specialist by and for services and sustainability for those. We've done a piece of research looking at the older LGBT plus experiences, and I completely echo what the comment states, is that there is a huge invisibility there. Often when we speak to organisations, they'll say, "Oh no, we don't really have older LGBT people in our service." Well, of course you do. You may not be asking those questions through kind of unconscious bias, and they're assuming that because they're an older person, they don't have, you know, a different sexual orientation or gender identities from what is heterosexual or cisgendered. So they are really invisible there. We know that from our research, talking to older LGBT people, that they're more likely to conceal their gender identity or sexual orientation in later life through fear of discrimination from potentially carers coming into the home. You know, we did hear an example of a man who actually burnt all of his possessions and photographic memories for real fear of someone coming in and discriminating him because of that. So I think that they are particularly hidden as a group. Their needs aren't considered as much as other older populations, which we know isn't great. And then for the BAMER, again, you know, most services are designed and targeted towards white women, which is really problematic for them and their needs. So it's really, you know, ensuring that there is that kind of representation of their voices when looking at designing services that are suitable for that older population.
Thanks, Rebecca. Now we've moved away slightly from the housing question, so we'll come back onto a more housing specific question, which is how can the government better ensure that domestic abuse housing support works for all types of domestic abuse victim survivors? Monsura, do you want to come in on that?
Yes. Okay. So I think firstly, perhaps would be best to kind of look at funding and looking at all these services that are hugely underfunded, and looking at different areas where it's underfunded, and making sure that enough money goes into the DV field in general, and making sure that all local authorities are funded well enough to equip and not just kind of give them money to kind of show that, you know, they're doing something, but actually do something. And make sure there's provisions and local services set up in the area around what that demographic needs, around what is actually needed in that particular area. So I think that would be a good place for it to start. Also ensuring that all the kind of acts and laws and things that they do put out there, making sure that it's all accountable. Making sure that things are being checked and double checked, and making sure that things are actually happening and things are moving. And we're not just providing some sort of tick box exercise, making sure that there are real changes that are happening, and, you know, kind of pioneering in certain areas and looking at what areas work well, why do they work well, and piloting perhaps in different areas and replicating that. If it's working well somewhere, then, you know, perhaps we should be doing this everywhere. So it's taking a real hard look and seeing and identifying what is actually needed, talking to local services and finding out what it is that they're talking to the local authority, looking at the demographics, looking at the data, making sure that things are put in place. That would be, I think, a good place to start. Also making sure that things like training around domestic abuse is made mandatory, and making sure that everyone does do that. Maybe embedding it into courses, for example. I know that social services have now, as part of their social care degrees, and now do have a little section around domestic abuse, which is great. And I think this should be kind of replicated in other areas. Same with whether it's police training or people coming into local authorities to work within housing, for example. It should all be embedded. The local VOG sector often offers training all the time for anyone that works within that borough, and it's very rarely taken up by, say, for instance, the police. I mean, a lot of it I do understand is to do with time and not having the resources and being overstretched, but is to make sure that they're actually receiving this and then have this as part of their everyday essential kind of training, and making sure that GPs and hospital staff and everyone that comes into contact basically with older people are trained around this. and make sure that they're trained around this, and making more accreditation available for people to take up would, I think, encourage lots of departments and services to make sure that they are training their staff in the correct way.
Thanks. Mark, you've already mentioned how the government can get involved here. Do you want to sort of enlarge on that a little bit?
Well, I think really the government are providing extra funding for safe accommodation, a lot of extra funding. I know it's never enough, but the government have provided extra funding. They've also provided the new statutory responsibility, and will be monitoring. They've set up an expert panel of providers, and it's led by the government minister, to actually monitor the compliance of it. So so the government can be involved, but I think it comes down to the commission service and other related charities in this space, and obviously working with yourself, Richard, and colleagues, and perhaps there could be something on the website about this new kind of statutory responsibility, because it's up to the government, but the government's only as good as anyone good if people are telling them that local councils are not complying. So it's really up to the commission services, the domestic abuse services, as I said, to make, and they sit on the partnership boards to make those local authorities make sure that they are providing that funding, because they have a legal duty, and those safe accommodation options for all victims, including their elderly victims. And the one thing I always say, I mean, I know any council officers on the webinar may not like it, but the key thing is that don't always go to the council officers. Go directly to the cabinet member, the local councillor, who is the cabinet member who for social adult care, who is the democratically accountable for safe accommodation and has the legal responsibility. So don't always go through the officials, go directly to the councillor and say your council is not complying with the law. I often find that can move things a lot faster. The government's, as I said, doing more on this. It's also going to be launching quite soon a refreshed national statement of expectations, which is broadly telling police, health services, local councils and all public bodies what their responsibilities are with regard to domestic abuse, but also other related crimes, sexual violence, sexual abuse, stalking, so-called HPV, and forced marriage. And again, commission services and other organisations should be waiving this at local authorities, saying, are you complying? Because if you're not, then you're breaching the law.
Does communication play a part in this, Isobel?
Absolutely. I mean, that's what I was going to say, is I think a big part of this, and a big part of part of the question there, making sure housing support works for all types of domestic abuse victims. A massive part of that is actually listening to those victims. What is it that you need? What is it that you're not getting? What is it that we need to improve upon, and amplifying those people's voices, and then filling in those service provision gaps. So making sure we are communicating with victims, and that we've got the resources to then provide the services that they need.
Okay, before I go to Rebecca, just to go through a couple of points here. So Karen Evans mentions, whilst there is a lot of additional funding and requirement to undertake the needs assessment, the funding can only be used to deliver support within safe accommodation, rather than, for example, buying additional properties which could be used to increase refuge capacity. And Julie Vigo-Saunders mentions that all nursing staff have mandatory safeguarding training provided around adult safeguarding, covering older adult abuse. We even have safeguarding champions events, which is really, really interesting. But going back to the broader question around how the government can better ensure that domestic abuse housing support works for all, do you want to come in on that, Rebecca?
Yeah, so I think it really does start with any policy and guidance document for domestic abuse, ensuring that it includes all older victim survivors. In terms of commissioning for housing, it's really a blended approach to recognising that one size doesn't really fit all. However, the general principle is that if it does meet the needs of the most marginalised victim, then it's going to meet the needs of everybody. And so to consider that in the design. We took one of our victim survivors who engaged in research down to a housing property in our local region, and we took them around the space, and they really gave their thoughts on how accessible that was. And I think being in that space, they were able to give more of an input than just having a telephone conversation or taking part in a focus group. So potentially, you know, if there is scope to do that, inviting people along to come to those spaces and to give an input, I think will prove to be really valuable. In terms of the location of these housing spaces, ideally they be more local, because older people tend to have access to services and support networks in their current kind of local communities, so they may not be able to travel or get to those spaces easily, particularly in rural Wales, where there's multiple buses to get just back and forth to one location. So that can be really challenging for older people if they can't get on and off several buses and that travel throughout the day. But I think it's also then the consideration of the proximity to the perpetrator. So we know that older people's housing can be grouped in one locality. So the only one available housing may be on the same street as the perpetrator, so that does need some consideration there. But also, you know, I've mentioned before about kind of ground floor and accessibility with accessing that. A lot of our older clients have said that they prefer to be off the floor as they feel safer. But there isn't always lifts to be able to accommodate that. So really kind of having that accessible, dispersed, supported accommodation, you know, having secure tenancies, because we know that older people are less likely to move on. So there's a real need for security in terms of permanency of housing there, but also kind of assistance with grants and furnishing, so emergency housing packs that currently they're quite suitable for younger people, but maybe not necessarily for an older person. So to give that some more consideration too.
Is there a broader issue here, Mark? You've mentioned this in your most recent comment here. Is there an issue here around medical needs, dementia, undiagnosed infections, etc.? How can local authorities and governments provide that sort of patchwork of available housing when there is this complex, really complex need? Is that something any of the panelists have dealt with or have a take on?
Yeah, I mean, I often work with a lot of service users who either have dementia or the onset of dementia or Alzheimer's themselves, or the perpetrator does. So then obviously that perpetrator is a vulnerable perpetrator. So, I mean, we have to tread really carefully here. I think there could be more done with the local authority. For example, social services can have a bigger input in terms of how the safety plan can go. I think the issue kind of is very much dependent on capacity. It's a really big topic to kind of discuss and unpick. But I do think that if social services had a lot more involvement, or if, for example, their threshold wasn't so high, then they could potentially move on the vulnerable perpetrator for the victim survivor to have her own space, or to continue to live in the property that they live in, not have to go through housing, not have to be rehoused, not have to sell a property, not have to look at any of those things, you know, at her later stage in life. Same goes for, you know, if it was the other way around, if they were able to, if the victim survivor herself had some sort of capacity issue or didn't have capacity issues at the time of when they got involved, I think it's a really difficult place to be, especially with like needing medical care. It brings on so many barriers in itself in terms of needing accessible homes. I think one of the things that I'm trying to do in terms of working with some of the local authorities and local housing associations is identify housing associations where they have a large stock of sheltered accommodation and supported sheltered accommodation, assisted living, and asking them if they would be, willing to provide some of that as temporary accommodation. Because what we find is that we need accessible properties. There are accessible properties out there. There are long waiting lists for sheltered accommodation and assisted living. However, there might be some in some areas where they have a lot, where it can be used as temporary accommodation for the victim survivor to kind of move into on a temporary basis, whether that's long-term, short-term, so they can then look at resolving the longer term kind of housing issues and getting social services involved. So I do think it's a tough one, because we have to also consider everyone's kind of rights and right to privacy and data protection and all of those things. But yeah, unfortunately, a lot of it is kind of tied up in red tape, which makes it even harder for service users to kind of break those barriers and just move on in a smooth way.
Thanks, Monsura. Mark, do you want to come in on that?
Yeah, I mean, certainly agree with all of that. I mean, I'm actually sitting on a domestic homicide review, and where this situation played out. And what was interesting, is still ongoing, is that the lady who had the onset of dementia, who was carrying out the abuse, probably didn't quite know what she was doing because of the situation she was in. But it was interesting, the adult social care were all focused on her needs and not the needs of her husband, who was obviously at the receiving end of that. And that's one of the reflections that will come out in the domestic homicide review. What's also interesting on that homicide review is the aspect of chivalry. And so for that chap, he wouldn't leave his wife because he felt he'd been married for 40 years, didn't think it was the right thing to do, wanted to look after her, make sure that her needs come before his. And I'm sure that happens for women with men in that same situation as well. And so, the older generation, that whole chivalry thing is still very, very prominent and that obviously needs to be taken into account as well, because lots of the elderly population will always put their partner first.
Rebecca, you had your hand up there.
Yeah, I was just going to share a case study that we had. A woman, she was in her 80s. She was living with dementia. She still had a lot of independence. She was really well integrated into a local community. She'd lived there for over 66 years, I think. So the people at the local shop knew her hairdresser knew her, the general community did. So she was still able to get out and about and exercise that independence. When the domestic abuse was reported to the local authority, they decided that she was at too high of a risk to stay living with the perpetrator, who was her husband. And as a consequence of that, they actually moved her into a care home. And as a result, she lost a lot of her independence. She then not only had to leave her community, but also lose that kind of independence on a daily basis. And the decision was made that she would end up in a care home eventually anyway, so it was best to move her out now than it was to move the perpetrator. But subsequently she lost a lot of those protective factors, and we actually felt that it was him who should have gone rather than her. And I think there is a lot more to be done there around supporting victim survivors to remain within their households. Somebody mentioned, I think in the comments, about sanctuary schemes, and I think they could be utilised a lot more.
How often does this come up on frontline from an Hourglass perspective, Isobel?
It's not thoroughly uncommon. I can think of a few cases, you know, where dementia has played a significant factor, and the situation that Mark just described, where the perpetrator has dementia and the partner is their sole carer, and they don't want to leave that person because they've spent their whole lives together, and they do have that loyalty. And I think in those situations, just as in any kind of situation, it's about respecting that victim's wishes, and making sure that they can do what they want, but that they're supported to do that safely. So looking at risk assessments, just reading the Dewis Choice Toolkit yesterday, looking at risk assessments with personal care. So is personal care something that maybe the victim should be involved with, or does that need to be handed off to an external agency and the victim can support with meal planning? So it's taking a kind of creative approach to risk assessment, and also being curious, looking at how those complex needs intersect, really trying to understand the dynamic of that relationship, so that when we're not overlooking potentially really serious risk factors.
That's really useful. We are actually running out of time here. I think what seems to be the case is that there is an almost complete agreement that there is a significant hole in the services that are available in terms of providing correct housing to meet a real patchwork of needs across the UK, whether that's for older people, whether that's for male victims or male older victims, survivors, but also looking at other areas where there is insufficient support met. And I think from the 4 people who have discussed this in great detail, there's such expertise and understanding here that perhaps another thing that the government and other local authorities could do is to perhaps tap into that expertise, which is which is here, to look at how that service provision can be built and supported. I just wondered whether any of the panel had any final comments before I end the webinar, because I know that perhaps there are a couple of interesting issues we haven't talked about from your own service provision. For example, I know, Mark, you talked earlier about the services that you are looking to continue to fund, which is specialist to male victims.
Yeah, I think it's important that there are specialist services for male victims, but I think the important thing is that those specialist services and staff can be within the actual commission services. So what we're seeing at the moment, and it's interesting because I'm at the launch actually today in Bradford of a national helpline for South Asian men who are victims of domestic abuse. And Sunny is in Bradford as well. It's a wonderful city. And so it's important to have specialist services, but it's not always going to be possible. So what there should be is that there should be specialist funding within commission services. So commission services funded by the local authority to provide domestic abuse support for all victims. Then what we're seeing is a move to having specific support workers and IDVAs with a client base which is based on either male or LGBT victims or elderly victims, depending on the numbers, but we're having dedicated expert IDVAs within commission services. So it means that no one falls between the cracks and the gaps, but it means that there's some specific expertise within organisations. And I certainly think that that is the way to go, and we'd certainly like to see more of that actually in London and in other parts of the country, but it is happening all the time now. Some services are actually setting up, commission services are setting up separate brands as well. So we've got brands like Save Dave and Ask Mark, for example, and the Adam Project and others, which is basically one commission service, and they have a specifically branded service for women and one for men, but it's operated by the same organisation. For those of a certain vintage, it's almost like the Top Shop, Top Man type approach, where you know, one organisation that has two branches always next to each other. Although I think they've all gone bankrupt now, but that's a concept. And we just need more funding for specialist support generally to provide so we can have better gender informed, age informed, and meet all of that 360-degree aspect of domestic abuse that I spoke about.
Thanks, Mark. Well, I'm delighted to tell you that Topshop is still alive. So it's online now, but I'm delighted to be that person to put that into the debate.
I always went to Burton, Richard. So
I'd never guess with your sartorial elegance there, Mark. Okay. Right, Rebecca, sorry, just to highlight your services really quickly. Dewis have got a real track record of the research that you've been doing. Is that all online?
Yeah, so we do have a website, dewischoice.org.uk, and we have a resources page there where you can download all of our resources that we've designed over the last 7 years. They are all free to download. We also did a piece with EROSH on housing and domestic abuse in older people, which can be accessed through the EROSH members page. We do have a number of resources that are coming out now in the next couple of months. So do keep an eye on the website there for access to those, and follow our Twitter for the launches of some of them. And then our research publications can also be found online on the website under our research section as well.
Monsura, likewise, your services are available online, and do you have a helpline?
Yes, so we have an advice line hub, so people can call in, and that's whether it's professionals or service users directly can call in. You can have a look on our website. The telephone number is on there. It's a free phone telephone number. We have a number of resources that, again, is available online as well. We have a few research projects that we've done. We've actually did a toolkit with the Dewis Choice as well. So that should be online and available to download. And yeah, we have lots of various different services that sits within Solace Women's Aid. It's quite a large organisation, different boroughs, different types of services. So just go online and have a look. You'll find most of the information on there.
Okay, and Isobel, from an Hourglass perspective, what's available?
So, oh, sorry. We've got our 24/7 helpline, which is reachable on 0808 808 8141. You can also navigate to our website, which is www.wearehourglass.org, where we have an instant messenger service as well as a chatbot. We've also got our helpline email, which is helpline@wearehourglass.org, and we also have a text phone service, which you can find through our website as well. We've got lots of information on there. We've got also a knowledge bank, research which is done by our policy team. So there's a whole host of information on there, and I'd encourage anyone who's concerned about an older person, please do reach out to our helpline and we'll be happy to support you.
Fantastic. Well, look, there is a fantastic amount of information out there, and Mankind are available on you have a web link as well, don't you, Mark?
Yeah, so we have we provide a helpline 10 till 4 weekdays. Lots of information on our website. We also have a directory of services. So basically, men and obviously professionals can go on our website and see, if they don't know, where their local community-based services are. And we're finding lots of men are actually using that service. So rather than going through to the helpline, we're triaging them off online, if you like, straight to their local community website. We also, as I mentioned, we've launched some quality standards for services for male victims, which are featured in the statutory guidance, which we got Home Office funding for some 18 months ago. And also we provide training and other support for local councils. All of that's on our website, which is mankind.org.uk.
Thanks, Mark. And Laurie has just put that out there on the chat as well for everyone. I am going to close the webinar now. I want to thank everybody for taking an interest in the in our chat today, to Monsura, to Mark, Isobel and Rebecca, and to everybody who has chatted. It's been a really interesting discussion and shows quite what the challenges are. But thank you, everybody. And I will now close the webinar. Thank you very much.